Everybody. It is Dr. Dietrich with another episode of Relax Well with Dr. Dietrich, and thank y'all very much for joining me tonight. By the way, I am here every night at 8 p.m., every Wednesday night at 8 p.m. Central Standard Time here at Dr. Dietrich G. And I'll talk about different things concerning relaxation, stress reduction, other various topics, health topics, all that stuff. And it'll be right here every Wednesday. So tonight I'm actually going to be talking about briefly about mental health awareness. Please tag folks to come on in, listen, share this live stream, and of course, if you're watching this on the replay, please put hashtag replay in the comments. And let's see who's going to be coming in tonight. I'm just going to keep it going because it is going to be a brief live stream tonight, but it's still going to be very good. Hey, Stephanie, thank you for joining. And thank you very much, Susie, for joining too. Thank you, thank you. So, May is actually Mental Health Awareness Month. Y'all may or may not know that, but actually, according to the National Health Council, .org, 1 in 5 U.S. adults actually experience mental illness each year. Okay, 1 in 5. Hey, Trina, thanks for joining. 1 in 5 U.S. adults actually experience mental illness each year. 1 in 20 adults experience a serious mental illness each year. And 50% all lifetime mental illness actually begins at the age of 14 and 75% by the age of 24. So you kind of start getting these flags, early on in life. All right. But this is a mental illness awareness month. What does mental illness mean actually? Does anybody have a guess or anybody want to put it in the chat? Hey, Yvonne, thanks for joining. And this information I'm talking about tonight is actually coming from the CDC. Well, okay, mental illness is actually it's a very broad term, but it refers to mental conditions or mental disorders that affect how you actually think, how you feel, how you behave, what your mood is, that kind of stuff. Some of the examples of mental illness that you may have heard of are like anxiety, depression, like addictive behaviors, eating disorders, schizophrenia, bipolar. You've heard of all of these disorders, and there's plenty more. And please don't worry, I'm not going to go through each mental illness tonight. That would be too much. It's a lot going on with it. But those are just some examples of some mental illnesses. And there's actually really not a single cause for mental health problems. It's actually what's called multifactorial, many different things. So, like your genetics can play a role in it, um, your environment, your biology, chemical imbalances in the brain, social and family environment. Actually, even if you have chronic medical conditions, that can set you up for having issues that way. If you use drugs and alcohol, and all these interactions, all of these things. So it's very, very multifactorial as far as what causes mental illness or mental health issues. But how do you get to the bottom of it, or how do you actually diagnose mental illness? Hey, Chanel, thank you for joining. Thank you very much. So you would diagnose it by getting a good old fashioned physical exam, and that's like a big step. Just even going into the doctor just to have a physical exam. A lot of people really wait till things are like breaking off before they go get seen, and so your doctor will actually try and rule out other physical problems that could be actually causing some of your symptoms. So, for example, if you're depressed, you want to make sure you're not anemic, you don't have any thyroid issues, that kind of thing. So there's other physical exam findings that could possibly be ruled out that could be a reason for why you're coming in feeling down, for example. You may have lab tests done. Like I said before, you might check your thyroid, if you're feeling down. You may have to do like an alcohol or a drug screen. You may just have to get general labs just to see if everything is quote normal or within normal reference range, because having abnormal labs can actually contribute to changes in how your body works and even how your brain thinks. Then to get down to it, you'll actually undergo a psychological evaluation. So a doctor or a mental health professional, they'll talk to you actually about your symptoms, your thoughts, your feelings, your behavioral patterns, and you actually may be asked a whole bunch of questions, but you also may be asked to fill out a questionnaire to help answer some of these questions. Hey, Kasali, thanks for joining. And so, what are like some other treatments? So, like I said, the cause is multifactorial. The treatments can also be multidimensional. It's actually going to depend on the type of mental illness that you're diagnosed with, how severe it is. All right. So think about it that way. And it can actually involve multiple treatment modalities. It may also involve different members of the healthcare community, including like your physician or other healthcare professional, um, pharmacists, psychiatrists, social work, a therapist, even your family members. They may be involved as well in your overall care. So thanks, Trina. This she says this is interesting. There's so much that goes on in the body that deals with mood. Then think of it that way. Absolutely, is the body is just sitting here thinking about the body and even the brain in particular is really, and no pun intended, it's just really mind-boggling. I mean, there's so many different things that go on in each little individual cell in your body, and just everything has to be in sync to be working as a functioning organ. And when some of those things get off, like chemical imbalances, it can really play a role in your overall health. So the human body is just so fascinating. Hey Nancy, thanks for joining. So I was just saying, like your treatment team can involve a whole bunch of different folks. It's very multifaceted. And the main thing is, if you happen to be diagnosed with a mental illness, is to really kind of be involved in your own care. Work with your healthcare professionals. Take medications if you just need to. Let others help you. And so just, I'm just being fully transparent. Mother's Day is around the corner and whatnot. And, I've been going through things in my mind that has caused me to feel a little bit down, life, work, just kind of all kinds of different things and, feeling a little bit down. And those of you who know me know my mom passed away a couple of years ago. And so this is definitely contributing to how I'm feeling now, among other things. And so I'm just putting it out there just to know that, even me, I may seem all bubbly and happy, doing these live streams. And, for the most part, I am, but, I'm a human being too. And so everyone needs someone to talk to. You need to just get help if you need to get help. It's just as simple as that. And try not to feel embarrassed, or if you do, kind of get over the embarrassment and go seek the help that you need. Just don't feel ashamed about it. And one final note, though, is actually if a loved one, comes to you and they're coming from a place of love and goodwill, that you may need help, or if they feel that there's a concern, just listen, kind of listen with an open mind, get over that embarrassment, or at least try to get over that embarrassment and really think about what they're saying and just kind of really listen, because it can actually take a lot for a person to approach you if they feel that there's a concern. Um, Family members, mental illnesses can actually run in families, but like I said, it is multifactorial. So if someone does come to you or feel that you may need an evaluation, just really think about that and consider it, or at least look into it. So I don't know. This is, like I said, this is a short, brief live stream. May is Mental Illness Awareness Month. And so, does anyone have any questions that they want to throw out there? This is just a brief overview. I may do another live stream, getting a little bit more detail later in the month. We'll just see how that goes. And again, thank you very much for joining. Yvonne, Chanel, Trina, Stephanie, Susie, Kasali, Nancy, all y'all folks. And thank you very much for being support. And also, finally, before I chime out, Mother's Day is coming up. So happy Mother's Day to all of you moms out there, to all of you mother figures out there. Um, keep doing a great job. Keep loving your kids, and all you kids out there, keep loving your mother. Love. All right. So I want y'all to have a wonderful evening, and I will see y'all next week. Thank you very much for joining me tonight. And join me every Wednesday at 8 p.m. Central Standard Time right here at Dr. Dietrich G for Relax Well with Dr. Dietrich. Thank you very much. Okay, bye, y'all.